Today I have Dr. Wayne Aldredge with me, and we're going to be talking about the comprehensive perio examination. Hello there, Dr. Aldredge.
Hey Marty, thanks for having me here today.
It's a pleasure. Dr. Aldredge is a periodontist and implant specialist. He is board certified by the American Board of Periodontology and a clinical assistant professor in the Department of Periodontics and Dental Implantology at Stony Brook University. So, what does the comprehensive perio exam or evaluation, what really is it?
Well, thanks Marty. Comprehensive periodontal evaluation, or CPE for short, is part of the foundation or the bedrock of any good dental examination. What we want to do is evaluate the teeth, but more importantly the structures that hold your teeth in there, the gums and the bones and the periodontal ligament. So what we want to do is, with a special ruler, we'll go down between the tooth and gums and we'll evaluate what the bone levels are, and the bone is actually what supports and holds the teeth in there. What we'll find is the most important parts of a comprehensive periodontal evaluation is checking for mobility, checking the pockets around the teeth, how much bone loss has melted away, checking for recession. All things being equal, if we really look at a tooth and we want to evaluate everything going on in somebody's mouth, we want to evaluate how long those teeth are going to stay there. Are these teeth healthy enough to hold a bridge or a new veneer or a partial denture? So comprehensive periodontal examination is also part of a patient's record file for the long term. Now say somebody's 25, 26 years old, and this is their first time at your office. Well, to give them informed consent and proper treatment plan, you can't just look at the teeth and look for cavities or root canals or the plaque there. We also have to look to see what's going on underneath the gums. I consider myself the foundation guy. Periodontists or general practitioners, when they start looking at the comprehensive periodontal evaluation, they're really trying to see how the foundation of the house is doing. How is that house holding up underneath? So a comprehensive periodontal evaluation could be considered part of the bedrock of informed consent for a patient.
So what is the value to the patient of this comprehensive examination?
Well, the value to the patient is similar to the value to the dentist. The patient knows all of the problems in their mouth. Think if you go to buy a house, you're going to go get a home inspection. Well, if they don't go look down in the basement and look into the foundation, guess what? You didn't have a comprehensive evaluation. So it's one thing to, and I consider dentists to be educators. Our job is to educate with the patient, let them know what the problems are. But if we don't look in all the little corners, we don't know what all the problems are. It doesn't mean that the patient has to accept or follow through with all the treatment, but at least we've done our fiduciary responsibility. We've given them the information to make proper decisions, so your dentistry will be there forever.
And what is the value of spending the time on this evaluation for the dentist?
I believe a proper periodontal or comprehensive periodontal evaluation can take 20 to 35 minutes. And if you find a patient who's at risk, that's when you may decide this patient needs to be co-managed. So you'll call your specialist up and say, hey, Wayne, I'm sending Mrs. Jones over there. And communication is very important when it comes to patients, because we want the best treatment outcomes. So you may say this patient's going to come to my office, and we have the time, and I don't have a 2,000 or 3,000 patient base. We're not as busy as general dentists. I don't know if that's the right word, but we look at it differently. When somebody comes in, we're sort of like the cardiologist at times, I think. As an internist or a physician, you're going to do your evaluations and screen patients who don't need that level of care. But when you find somebody who has that heart disease or that other level type of problem, you make the referral. And it's co-management. I don't want to keep the patient because I'm really just looking in the basement. I want you to evaluate the house and make sure that everything's going to be there, and we work as a team.
Thank you, Wayne. That was very informative. A lot of times general dentists forget that the bedrock of good periodontics is what allows all of our restorative dentistry to hopefully last a good long time.